Do you think some people are more predisposed than others to pain? I mean, could pain be passed down through generations? Is pain environmental, like you talk about the trauma pain connection? Or are some people, just born more sensitive to it?
Well, I think it's hard to say whether anybody's born more sensitive to it. One of the issues with pain is it's subjective. You can't really measure it. You can't say, well, this person has more pain than that person. So you can't say that person's more sensitive to pain than another person. But there are factors that can predispose people to more pain. For instance, as you mentioned, trauma. If you've got trauma in your past, and the worst trauma is chronic childhood trauma in terms of being abused or neglected as a child, if you've got that in your past, you're more likely to develop chronic pain or any chronic illness. And there's a very specific reason for that. If you've got trauma in your past and you haven't worked it through, your body tends to be in hyperarousal all the time. And that means that your muscles are always tense. You may not be sleeping as well. Your digestion is impaired. Your immune system is impaired. And all of those things affect whether you develop pain. And if you are injured, it determines how well you heal from pain.
Welcome to yourbrilliance.com. I'm your host, Amy Waterman. And today we're talking to those of you who hurt. You know who you are. Pain has been part of your life for too long. And nothing you do seems to help. You've talked to your doctor and they've suggested medications or physical therapy or acupuncture. And maybe you've tried those things if they helped a little, but they haven't fixed the problem. So how do you live like this with a body that you can't even trust? And maybe it's even changed your personality. Maybe you're more impatient or more irritable or maybe even a little more depressed. You just want your life back. Well, our guest for today, Cindy Perlin, has some strategies that might help. Cindy is a licensed clinical social worker, a certified biofeedback practitioner, and a chronic pain survivor herself. She's the author of The Truth About Chronic Pain Treatments and the creator of the online Alternative Pain Treatment Directory. She's been in private practice in the Albany, New York area for over 25 years, helping clients achieve their health and wellness goals. Welcome, Cindy.
Thank you.
So let's start out with how you got into chronic pain treatment. You experienced chronic pain from a pretty young age.
Right. When I was 25, which was a little over 40 years ago, I hurt my back. I was running and I gradually developed more and more back pain and I stopped running, but the pain didn't go away. And I got to the point where I was in so much pain I couldn't function. I had to drop out of graduate school. And I spent 3.5 years in that state, just beside myself with pain, not finding any answers from the doctors. And then finally, a friend of mine suggested that I get a book called Anatomy of an Epidemic. One of my therapy cats is here. This is
that's really
big help. But an unexpected visitor today. So anyway, I read this book, and it's about a man who had a chronic, crippling, progressive joint disease. And he laughed himself back to health. And the book was about the mind-body connection, and it mentioned biofeedback. And I went for a couple of biofeedback sessions, and it turned my life around. In a day, I was 50% better.
Wow, and that's what you do now, don't you? That's one of the things that you do.
Yes, I do biofeedback a lot with people in pain, and I find that that's really helpful. And, I just went on to explore other things that would help with pain and got more and more interested in it, got better, got back to an administrative job, and then many years later left to do what I do now, which is work with clients with physical and emotional problems and help them get better. And a big part of that is biofeedback.
So I have to, of course, ask you a question. You said that you had read a book about a man who used laughter to feel better. Did you ever try that?
Yes, at the time that I read the book, I was home staying in bed because one of the practitioners I went to told me to do that. I was watching the Holocaust miniseries.
Oh.
I was reading books about World War II and the Holocaust, and I had no idea why I felt so depressed and why I was in so much pain. And so when I read the book, we have another visitor. When I read the book, I realized that it did make a difference what I was filling my mind with. And so my friend's back. So I changed. I started watching more funny things, and
oh, that is so sweet. So all of you with chronic pain right now who's watching it, maybe we all feel better because we're watching cute cat videos, right?
Yeah, I have a plan to make some cute cat videos about healing with pet therapy. But
fantastic.
sometimes they're out of my control a little bit. So anyway.
I love that though, because there's a mood pain connection there.
There definitely is. One of the things that I discovered was that part of my problem was I was in so much fear because I felt so out of control. And when I learned about biofeedback and I learned I could have some control, that made all the difference. The fear went away. My friend's back again.
That's okay. It's cute. That is amazing, because I think one of the things that we don't realize is how much our pain is that uncontrollable feeling feeds the pain.
Mm-hmm.
Yeah.
Mm-hmm.
So I want to ask you about, there's so many different kinds of pain, right? There is, arthritis pain, people have aching backs. There's the pain that comes along with health conditions like autoimmune. Does each of these kinds of chronic pain need to be managed differently, or is there kind of an overarching theory or management of pain?
Well, there is some difference in terms of different pain conditions, in terms of whether it's mainly physical or mainly mental, emotional. And I discovered this myself in my own journey through pain, because with my back pain, the mind-body approach was really helpful. And then after I got better from that, I developed foot pain. And I kept trying to fix my foot pain with the mind-body approach, and that wasn't working. And that was because my foot pain was post-surgical, and it was basically a muscle imbalance that was created when I was healing from the surgery, and I was using my foot differently. And so I was walking on the side of my foot so I wouldn't, stress the incision, and everything in my foot and leg got shortened, and I could no longer walk normally. And it took 14 years to figure that out. And, in that particular situation, the mind-body approach was very little help. So you do have to look at what the root causes are. Another root cause is nutrition. And, there are nutritional deficiencies that will create chronic pain. For instance, vitamin D deficiency, which is very common, can cause widespread body pain. If you're ingesting aspartame, which is NutraSweet, which is found in a lot of calorie-free beverages and other things, that could cause a fibromyalgia-like condition or an MS-like condition. So, lack of exercise can make a difference. There's many things to look at, a lot of them under our control, that could be causing the pain. And so you need to look at each case differently and, try to determine which factors are causing the pain and what will relieve it.
Mm-hmm. Do you think some people are more predisposed than others to pain? I mean, could pain be passed down through generations? Is pain environmental, like you talk about the trauma pain connection? Or are some people, just born more sensitive to it?
Well, I think it's hard to say whether anybody's born more sensitive to it. One of the issues with pain is it's subjective. You can't really measure it. You can't say, well, this person has more pain than that person. So you can't say that person's more sensitive to pain than another person. But there are factors that can predispose people to more pain. For instance, as you mentioned, trauma. If you've got trauma in your past, and the worst trauma is chronic childhood trauma in terms of being abused or neglected as a child. If you've got that in your past, you're more likely to develop chronic pain or any chronic illness. And there's a very specific reason for that. If you've got trauma in your past and you haven't worked it through, your body tends to be in hyperarousal all the time. And that means that your muscles are always tense. You may not be sleeping as well. Your digestion is impaired. Your immune system is impaired. And all of those things affect whether you develop pain. And if you are injured, it determines how well you heal from pain.
Wow. So it's amazing to think that therapy actually could treat chronic pain.
Yeah, and there's a lot of research that says that it works very well. And there's a lot of research on something called cognitive behavioral therapy, which is about how we tend to think, whether we tend to think the worst or think the best, whether we tend to worry, whether, we tend to do what's called catastrophizing, think the worst about anything, whether we're optimistic or pessimistic. That makes a big difference. And getting some intervention that makes you more aware of your thoughts and how they're affecting your pain or your body in general can be very helpful. There's also trauma techniques that can be very helpful. One that I do is an energy psychology technique where you work with the energy of your emotions around trauma. And if you can diffuse the charge that's related to a memory, then you can often get rid of pain.
Yes, like EMDR, I know, is one of those.
Yeah, EMDR is, it's not strictly an energy psychology technique, but it works with eye movements and reconnecting the different parts of your brain that can get dissociated during a trauma and that prevent you from working it through. And then once you do that, you can often very rapidly move past it. Because one of the things about trauma is people get stuck in time. There's a part of their brain that still thinks they're in danger. And that's the reason for the hypervigilance. So EMDR helps people realize that's in the past, I'm safe now, and I don't have to be on hyperarousal all the time.
So what's amazing to me about the conversation we're having is this is not the kind of conversation patients have with their doctors, right? So someone with chronic pain goes to their doctor, says, I'm having this issue. The doctor tries to find out what's wrong. Oftentimes the doctor can't kind of pinpoint anything and they say, oh, well, you've got, non-specific back pain. You've got this general thing. Let's look at your options. You can do medications or maybe these injections or, maybe there's a surgery that might help. But patients aren't getting the kind of options that you've just talked about. So how can patients kind of decide how they want to tackle dealing with this?
Well, it's a very good question, because most of the time when people are in pain, they don't get the right answers from their doctors. And sometimes they get the wrong answers, like your back pain is from what shows up on your MRI. It's this disc or that disc, and they go through surgery and they're actually worse, because the surgery has been invasive and created injury in the body, and then, the person's not healing. There was a study that found that the more types of childhood trauma someone had, the less likely they were to have a successful back surgery. If you've got all the kinds of possible trauma like sexual abuse, physical abuse, emotional abuse, alcoholic parent, domestic violence, if you've got all of those things, your chance of a successful back surgery is zero. Yet, for the most part, surgeons don't screen for that. So, one of the reasons I wrote my book and one of the reasons I developed my alternative pain treatment website, which is paintreatmentdirectory.com, is because people need someplace to go to find answers. And both of those things are overviews of the options. What are the bad options? What are the good options? And among the bad options are opioids for most people and surgery for most people, because they don't get at the underlying problem, which could be nutritional, it could be emotional, it could be, structural in terms of it's really a muscle imbalance kind of thing that's creating the pain.
So who can you trust to kind of help you narrow down the cause? Like, you can't trust your family doctor. Do you need to go to a rheumatologist or an osteopath, or do you need to go to like a naturopath? Who's the person who's going to help you figure out which course of treatment you should take?
Well, the very best option is what's called an interdisciplinary pain clinic. where you go in and you get evaluated by different specialists who then, look at your situation and what its possible causes are and give you a comprehensive plan. And we used to have a lot of those. We used to have about 1,000 in the country. They were growing in popularity. And then HMOs came along and they said, that's just too expensive. We'd rather pay for an opioid. So it's very difficult. So, your best option is to find some sort of healthcare practitioner who's at least informed about all the options. And that's generally not going to be your family doctor. What was found in a study was that medical schools on average give doctors about 2 hours of training on pain. And that includes diagnosis, treatment, medication, alternatives, an average of less than 2 hours. And, even if you look at continuing education, it's mostly about drugs. And now the big thing is, we've been using too many opioids. Now we need to cut down, but there's no options, which is, again, it's why I created my website and wrote my book, because, people stumble around for years and they suffer and they get worse and nobody tells them there's a simple answer, or maybe not such a simple answer, but things that they can do themselves that will make a difference. And alternative practitioners who could help them.
So we've kind of covered 3 big things people can try. They can try biofeedback. If they've got trauma in their background, they can try therapy. They can try pinpointing any nutritional deficiencies. Is there anything else that you would suggest, kind of some of the biggies that people should explore?
Well, I think that it could be very helpful to look at what's going on with you, with your muscles. I think that going to some kind of a body worker, like a massage therapist, I like a particular kind called Rolfing, which is very deep body work where they actually get into not only the muscles, but the ligaments and the underlying tissues, and they rebalance everything. They actually straighten you out. And that's what finally helped me with my foot after 14 years of stumbling around. I went to 2 sessions of Rolfing and I had like a new foot. It was amazing. So you want to go to somebody who can look at you structurally, muscularly. A physical therapist can be helpful. They do some of that. One of the problems with physical therapy these days is that insurance companies haven't raised fees in 40 years. And so most physical therapy is, you're in and out very quickly. They're not doing a lot of hands-on. We have a lot of work to do with our medical system to reorient it to what really works and what really helps.
Yeah. So what about your work that you do? Do you just see patients in the New York area? Do you work via Skype? Like, what kind of things could you offer somebody who's listening to you right now and thinking, I'd love to talk to this woman more about my issues? How could they work with you?
Well, if you're not in the Albany, New York area where I practice, I do some phone consultation where, you can schedule a phone consult on the Alternative Pain Treatment Directory website, and we can go over what your situation is, what kind of pain you have, what you've tried, what your available resources are, because, a lot of treatment is expensive and people who've been in chronic pain for a long time don't have much money. So, what other resources within your geographic area, within your financial capacity to pay, what kinds of things would be helpful to you. And I do that.
Fantastic. Now, for those of you watching, if you want to get in contact with Cindy or just get a copy of her book or learn more about the resources she offers, we've got a link for you. Just go to yourbrilliance.org/Cindy. That's yourbrilliance.org/CINDY. Thank you, Cindy, so much for coming onto the show. And I wondered if there is any last message you would like to leave our viewers with.
Well, I think the most important thing I want to tell people is don't give up hope. I've talked to people who've been in pain for decades and they've been able to turn it around with the right treatment. So there is hope out there. Just keep looking, just keep learning and trying, because there is a way out of your pain.
Fantastic. Thank you. And thank you out there for watching. We hope to see you again soon. Until then, let your brilliance shine.